Sinus infections is one of the most common problems we see in our practice. In fact, it's kind of our expertise. A lot of people don't understand why they got the sinus infection or what's the rationale behind treatment with medicine or surgery to treat a sinus infection. It's pretty simple. The sinuses are hollow spaces in the bones of the face. They're lined with the same membrane that lines the inside of the nose. We have sinuses in the cheekbones, the forehead bones, the bones that run between the eyes and the nose, the ethmoids. These are actually a honeycomb of hollow cells on each side in the bone between the eyes and the nose. And then in the back of the nose at the base of the skull is the sphenoid sinus. The membranes that line the sinuses make mucus, and the cilia, the microscopic hair-like structures that are on the membranes, beat to move the mucus over the surface of the sinus, out of the sinus into the nose. The cilia in the nose sweep the mucus backward, and when everything's working the way it's supposed to, it's a thin, watery blanket of mucus that moves quickly and easily from the sinus to the nose to the throat, and we swallow that thin, watery mucus every time we swallow saliva without even thinking about it. The average adult swallows about 1 liter of nasal mucus a day. It's a glamorous thought. The pinch point in this system is the pathway that drains the sinus. In a normal, healthy patient, that's about the diameter of uncooked spaghetti. It does not take much membrane swelling to pinch that closed. Then the mucus that's made in the sinus cannot get out. Bacteria have a chance to overgrow in that mucus, and there's a sinus infection. Usually the immune system kicks into gear, knocks out the infection, the inflammation gets better, the swelling goes down, the pathway opens, the mucus drains out, patient's done with the infection. If your own immune system can't knock out the infection, usually one course of antibiotics will do the trick. Knock out the infection, inflammation gets better, swelling goes down, the obstruction's relieved, the mucus flows out. Sometimes it takes a very strong antibiotic, and that doesn't do the trick because there's no one antibiotic that will kill all the different bacteria that cause a sinus infection. It may take another antibiotic to cover the bacteria that were not killed by the first antibiotic. Along with that, we'll also give medicines to help take down the swelling. So usually a course of prednisone, strong anti-inflammatory medicine to take down the swelling in the nose to try to open the sinuses. If a patient has allergies, we'll also give an antihistamine to help take down the swelling. After 2 courses of antibiotics, prednisone treatment for allergy, if the symptoms are persisting, the logical next step is to get a CT scan of the sinuses, which is a roadmap for surgery. The CT gives us detailed information about which sinuses might be blocked and which sinuses we can open with a simple procedure to drain the infection out and get rid of these sinuses, hopefully once and for all. New technology is to use a balloon, and that's one of the special expertise that we have in our practice, using balloons to open the sinuses. Much easier for patients, less risk associated, and cheaper for the patient and for society. So if medicine doesn't work, next step would be trying a balloon.